I'm Marc Goodson, Director of Marketing and Sales for SpiraBrush CX, the new FDA-cleared method to obtain a cervical biopsy. We're here today to demonstrate to you and prepare you to use SpiraBrush CX. SpiraBrush CX is FDA cleared to be used in place of a punch biopsy. SpiraBrush CX is patented nationally and internationally. SpiraBrush CX causes less need for hemostasis. SpiraBrush uses the same CPT code that you're using now, cervical biopsy of the 57454, and the lab processing CPT code is also the same. It's an 88305. SpiraBrush CX obtains a full transepithelial sample. SpiraBrush CX saves time and cost. There is no maintenance for the SpiraBrush CX. It is a single-use disposable instrument. Therefore, there is no need for cleaning, sterilizing, or sharpening. Compared to the punch, the SpiraBrush technique of obtaining a cervical biopsy optimizes the highest level of patient care when taking into consideration patient outcomes and specimen sampling. SpiraBrush CX is the next generation of cervical sampling, optimizing specimen samples while minimizing side effects and complications such as pain and bleeding. And SpiraBrush is very straightforward to process and diagnose for the pathologist's view. As you know, prior to clinical trials, preclinical trials are required. The question for the preclinical trial was, can SpiraBrush CX obtain a full transepithelial sample? And the answer is absolutely yes. The preclinical trials were held at the City of Hope Hospital in Los Angeles. Here's a cross-section of the cervical discard tissue sampled with SpiraBrush CX at 10x magnification. Here you see the stroma. This is the basement membrane. And here is the intact epithelium. And as you can see, this is the area of the cervix with the epithelial tissue completely denuded after sampling with SpiraBrush CX. Having established that SpiraBrush CX obtained a full transepithelial sample, we proceeded with the full clinical trials. The clinical trial was very straightforward. The clinical trial was designed so that all the patients were already scheduled for a LEAP, which provides the definitive tissue sample. The lesion was partially sampled with SpiraBrush CX, and the remainder sampled with the punch. Pain and bleeding were recorded. The biopsy results were compared to the LEAP sections. The pathologists were completely masked. We included some of the study centers and the clinicians. Dr. Brad Monk at the University of California, Irvine, Dr. Juan Felix, head of surgical pathology at the University of Southern California and head of surgical pathology at Los Angeles Women's and Children's Hospital, Dr. Neil Lonke at Kaiser Permanente, Southern California, and Dr. Ramon Sestero at Arrowhead Regional Medical Center in Colton, California. Here is SpiraBrush CX from your colposcopic view. First, you identify the lesion. Then you place the brush directly on the lesion. Then using firm pressure, you rotate the brush head forward and back 3 times. Remove the brush and visually check the brush head to be sure it is covered with ample bloody mucoid material. Then you confirm the location of the sample and you will see some micropunctate bleeding as opposed to the rivulet of blood you would see with a punch biopsy. Then the head is snapped off and dropped into a vial of formalin and it goes to the lab. This is the pathologist's view. On the left, we see slides of the punch biopsy at low magnification and high magnification. On the right, we see slides of the SpiraBrush CX at low magnification and high magnification. At low magnification, the pathologist is looking for areas of relevant tissue, and as you can see, both the punch and the SpiraBrush CX are easily identified. And then when they flip over to high magnification, as you can see, the cells are very easily identified. From here, the pathologist makes a straightforward diagnosis, CIN 1, 2, 3, CIS, whatever the case may be. So, how did SpiraBrush do in the clinical trials? Better than the punch biopsy. Along with the clinical trial information, the FDA asked us to do a literature review comparing SpiraBrush CX to the punch biopsy with the correlation to LEAP. As you can see, the accuracy of SpiraBrush CX is virtually equivalent to the best punch study and substantially better than the rest. On the strength of this data, the wording from the FDA is that SpiraBrush CX is cleared for use in place of a punch biopsy, with the claim that there is less need for hemostasis. This is how SpiraBrush CX works in your office. The procedure kit is supplied at no cost to you. You use the same CPT code you are using now. A culpo with biopsy is 57454, and the lab is an 88305. The courier picks up the sample, takes it to the approved laboratory, and the results are reported in the usual way. To recap the 5 steps to a successful SpiraBrush CX cervical biopsy. 1. Visualize the lesion and stabilize the cervix. 2. Place the brush head directly on the lesion and rotate forward and back 3 times while pressing firmly. 3. Withdraw the brush and confirm that the brush head is covered with ample bloody mucoid material. 4. Visualize the lesion site and confirm the presence of micropunctate bleeding. 5. Hold the brush head and vial firmly with one hand, with the head inserted into the vial. Snap off and discard handle. Drop the brush head into the vial. Let's talk about SpiraBrush CX as a marketing tool for your pathology lab and your pathology lab representatives. In today's market, the ever-increasing demands on the times of the doctor are such that it is very difficult for your laboratory representative to get quality face-to-face sit-down time with the doctor. SpiraBrush CX provides that time, that quality face-to-face sit-down time with the doctor.